More than 112 million people have been infected with COVID-19 worldwide. But the impact of this pandemic on our mental health is much harder to assess. You can't take a test for it like the coronavirus, but psychiatrists have come up with a name for anxiety about the virus: COVID stress syndrome. It combines several factors, including fear of getting infected, fear of socio-economic impacts like losing your job, and obsessive-compulsive checking like tracking the latest data in your city or state.
So the levels go up when there's lots of infection in your community and you're frightened about getting infected yourself. And the levels go down as lockdowns are eased or restricted. And we're thinking that for most people, this syndrome will disappear once the pandemic is over.
For now, getting a headache or a cough can trigger anxiety about your health and loved ones. And just like long COVID or coronavirus patients suffering long-term damage, mental health problems developed during the pandemic could be long-lasting for some.
Folks are suffering. And if we don't create some type of meaningful response where we are investing adequately in mental health, where we're thinking creatively about solutions on how to get people access to mental health, where we're looking at coverage options for affordable healthcare and health insurance. If we don't do those things right now, I'm afraid that we're going to have a much bigger problem on our hands. It's going to last a whole lot longer than this virus has.
The advice from the US government on managing pandemic-related stress hasn't changed. Exercise, get lots of sleep, drink less alcohol. But with governments fighting a war on multiple fronts, mental health services can slide down the priority list. This is the White House's national strategy for the COVID-19 response, and it does mention expanding mental health services on several occasions. But other than calling for more funding and protections for patients from higher premiums, there's no actual roadmap for how to treat what will be a long-lasting symptom of this pandemic. Giles, Gibson for CGTN in Washington.